I'm Dr. Tom Hyde. I am the Chief Medical Officer at the LIBD Institute for Brain Development and Director of the Human Brain and Tissue Repository here. So I wasn't one of these kids who grew up at age 5 who wanted a stethoscope and wanted to be a doctor from that point of view. I think I could have done 100 things and enjoyed it, but this is what life presented me with, and so I ran with it. I hate to say it's happenstance, but I ended up at the University of Pennsylvania in the MD-PhD program as basically a sophomore in college. And so I started doing research in a laboratory that I enjoyed very much, which was one that was centered on the biological regulation of body weight and appetite. And then I decided, since my PhD was in those domains, that it made sense to specialize clinically in neurology, which is the study of brain function and diseases of brain function. And so the research once again led me to put my name into a search program, a job placement program, for lack of a better word, at the Society for Neuroscience meeting. I happened to interview with Dan Weinberger and Joel Kleinman, who I still work with to this day, and they offered me a job in 1989, and I've been working with them ever since, first at National Institute of Mental Health, and now here at the LIBD Institute. When you're donating for research, you have the opportunity not to touch one life, or 5 lives, or 10 lives from a given individual. The possibility exists of touching millions of people's lives, and I think that's what motivates a lot of individuals to donate. That, and the fact that if their loved one in particular suffered one of these disorders, if they had a son with schizophrenia, or a daughter with alcoholism, or a mother with dementia, they understand the price that exerts, the toll it takes on the family. And so that they're very eager that other families, maybe not this year, maybe in 5 years, 10 years, 20 years, 50 years, will not have to go through what they have just gone through for a year, or 20 years, or 40 years. Because these illnesses that we study have repercussions, not for the individual who suffers alone, but also for their family members, for their husbands or wives, their children, their parents, their brothers, their sisters. We work with an organ procurement organization, or organ donation organization in Michigan, and families are very generous to not only donate for transplant, where you know that you may be saving or markedly improving somebody's life with a heart or a lung or a kidney or a pancreas or a liver or a skin transplant or a bone transplant or a corneal transplant. The amount of things that we can transplant has increased, and the amount of difference it can make people's lives is immeasurable. As I'm fond of telling the families, there's no right or wrong decision when you're making a decision about donating tissue, particularly for research. Of course, I would like them to donate for research, but ultimately that is their decision that they're going to have to live with in a day, in a week, in a month, in a year. And so my advice to them when they say to me, well, what should I do? I say, you make a decision based upon your spiritual and religious and cultural beliefs, what you think your loved one would have wanted, whether they expressed directly or indirectly. And at the end of the day, what's going to make you feel better in a day, a week, a month, and a year? And that's the right answer. And if it's no, that's the right answer. And if it's yes, that's the right answer too. And if you need a little bit of time, we try to provide a little bit of time. We operate within the window of opportunity provided by the medical examiner. We try to encourage people to go forward in a unified fashion from the family perspective. It is a unique opportunity that we're being afforded by the generosity of the living relatives of the deceased to study these illnesses, to make medical advances that I am hopeful will lead us to a better understanding of the biology of illness and the next generation of treatments, maybe even for some illnesses, cures.